Part 5, page 12, Chapter 1, Orientation of the Human Body. This table that I'm viewing right here is preceded by this little topic heading here called The Language of Anatomy. And one of the things that comes to mind is that we were told as medical students at the University of Texas that the number of new words we would be imbibing that are not found in Webster's Collegiate Dictionary are about 25,000 in number over the course of 4 years. 25,000 is a large number of new words on average that we learn. It takes 5,000 new words in a language to become fluent in that language, so it's sort of the equivalent of becoming fluent in 5 different languages. And in the case of the sciences, we're possibly learning more than just 5. But so we need to begin here with vocabulary, and actually there are some idiomatic expressions that I need to apprise you of. So let's look here at orientation and direction. What does superior mean? We're a 2-legged animal, not a fish, and not a 4-legged animal. The dorsal fin of a shark is its most superior feature that sticks out of the water, and that's its back, basically. Whereas our back is a posterior feature, not a superior feature. It's our head or cranium, which is superior in the human body. So I need you to sort of come to that realization, and this represents direction upward. So the superior or cranial direction. Then we have the fish has a caudal fin, which is its tail, which is a posterior feature, but for us it's inferior because our feet, which would be the caudal direction or our tail, as it were here, is in a downward position. Okay, so we have superior and inferior. And we're going to be learning planes, and planes will divide that into parts. We'll take a look at that. But for now, superior, inferior, cranial, caudal. We also have something which is ventral, which is the equivalent of anterior. Ventral is a reference to the stomach, or the belly, as it were. Right, so if you were a dog or a cat, that would be an inferior feature. For us, it's not inferior. We belly up to the bar. It's an anterior feature. Okay, so it's this direction here, ventral. Okay, dorsal, again, is something that has to do with our back. Okay, on a 4-legged animal or a fish, that's the superior aspect. But on a 2-legged animal like us, whose position is erect, then we have a posterior feature going on. It's this way, is dorsal. Then we have the concept of medial, which is somewhere in between. It's in between ventral and dorsal, or it could be in between left and right lateral, or it could be any number of in-betweens. But so medial. Now, in this case, because we have bilateral symmetry at the mid-sagittal line, medial is going to be anywhere near the mid-sagittal line. So I would say to you, for instance, that if we're looking at the front of the body, here, this would be a sternum, and I would say that the sternum is medial between the left and the right shoulders. Okay, so the sternum is a medial feature, the nose is a medial feature, the umbilicus is a medial feature, right? So the trachea of the neck is a medial feature, whereas shoulders are lateral features, ears are lateral features. Here in anatomical position, notice the position of the hands, the palms are forward, okay? Actually, this over here represents anatomical position. We're standing erect on 2 feet. The hands are down at the sides, and the palms are facing forward. The most lateral aspect of the human body are the thumbs. And, of course, we have a term for thumb. That's not the word thumb, it's the word pollex. Okay, we'll come to that in a moment. Alrighty then. So we have our superior and our inferior aspects. We have our ventral and dorsal aspects. We have our medial aspects, which are along the mid-sagittal line in between the lateral aspects, which are as far away as possible from the mid-sagittal line. Okay, so lateral is away from medial, left or right. Then we have this term called intermediate. So let's consider that. And we need to think about intermediate, though, most often in terms of proximal and distal. So I'll come to intermediate in a second. Okay, I'll come back here. Let's look at proximal. Proximal means close. In most cases, it means close to the beginning of something. So our arms and legs were formed by limb buds. They budded away from the torso. So this aspect at the shoulder is going to be proximal. And then the hand, as you can see here with regard to distal was the furthest developmental aspect of that limb bud. So the hand is going to be distal. The shoulder will be proximal. It's the very beginning. Same thing with the hip is the beginning, most proximal. The foot is the most distal. Okay, then you could use the term intermediate. You could say the elbow is intermediate between the shoulder and the hand. The knee is intermediate between the hip and the foot. Here's the knee. Okay, the other thing that I'd like you to pay attention to is that when we use the term proximal and distal, we could also be describing a pathway. So the normal pathway of food is through the mouth, the esophagus, on down to the stomach, into the small and large intestines. That's the normal pathway, and we're not considering things like emesis or vomiting. We're considering the normal pathway. And so if the normal pathway is mouth, esophagus, stomach, small intestine, then you could say that the esophagus is intermediate between mouth and stomach. The stomach is intermediate between the esophagus and the small intestine, right? So the mouth is proximal to the stomach is distal to the mouth. The esophagus is intermediate between the two. So I'd like you to have that sense of ability to discuss those things. If there's an injury on the body that's between the elbow and the wrist, you would say that there's an injury on the body intermediate between the elbow and the wrist, and the injury might be 2 inches distal to the elbow and a number of inches proximal to the wrist. So you will identify more specifically to the attending physician who's listening to your nurse's notes or whatever notes it is that you're writing on behalf of the patient. Okay, so proximal and distal. Then we have superficial and deep. The skin is superficial to the underlying muscles. The muscles are deep to the skin. Deep to the muscles are the bones, and the muscles are intermediate between bones and skin. Okay, so superficial and deep. Okay, you discuss sometimes how deep the wound is if there is a wound in your patient, right? How deep is that wound? The wound is a certain number of millimeters or centimeters deep. If it's a superficial wound, that means it's not going so deep. Okay, and then we have specific nomenclature in which we're going to be actually describing parts of the body. So the frontal here is a reference to this portion of the anatomy of the forehead, is the frontal aspect of the facial anatomy. Orbital is something to do with the eye. The eye lives in the orbit. Nasal is referencing the nose. Oral, the mouth. Mental is a reference to the chin. Cervical is a reference to the neck, etc. You can go through all of these areas and you can find things. The shoulder is interesting. It's acromial. The anterior elbow is antecubital, and you should find an antecubital vein to take blood from. The knee is patellar. The thigh is referenced as femoral. The leg is referenced here. Remember, the leg is not a thigh. This is not a leg here. This is the leg. This is a thigh. So we have very marketplace rules going on. Most times we don't make the sural crural aspect, but the front of the leg is crural, the back of the leg is sural. You might not come across that. The great toe, it turns out, has a name. It's hallux, whereas the large first finger is going to be the pollex. Also, fingers and toes are 1 through 5. 1, 2, 3, 4, 5. The fifth finger is digiti minimi. Okay, we'll pick up in the next section.